think the pendulum from specializing in one sport, where many parents and coaches used to think that that was the best thing for their athlete to get into college or elite status, is starting to shift. When we look at research that is ongoing or anecdotally athletes who have reached the elite level, there's really not a lot of them that specialized at a young age. Many of them didn't start playing their sport on a very competitive level or only doing that sport until late teens. So there's definitely a lot of research and conversation going on regarding youth sports specialization. In general, there's two separate issues that are brought to mind when we think about youth sports specialization. Number one is our physical health, and we know that there is increased risk in many studies now that are starting to be published on bone, cartilage, and ligament injury. And those are really tricky things to treat on a sports medicine level and often can cause long-term injury in an athlete's body. The other issue is in mental health, and we look at issues related to burnout and mental health related to depression, anxiety related to sports, and that's a totally new thing that we're seeing more frequently in upper-level athletics and elite athletics. With your physical health in general, we tend to see more overuse injuries in younger athletes, which we used to really not see very much. Most athletes, the weakest link in their musculoskeletal system is their growth plates as they're growing, and that's the typical type of injury that we would see, but now we're seeing younger and younger large ligament and tendon injuries that are related to overuse. So it's kind of changing our mindset into why are these younger athletes getting injuries that we would typically see in older athletes whose growth plates are closed or in adults. So there's definitely some thought about, does your body have a set amount of throws or a set amount of mileage within it that it can withstand? And how can we possibly spread that out over time to make sure that athletes don't reach their pinnacle before they hit the level that they would like to hit? And in most cases, that's college age or older in some professional athletes. And so there's a lot of research ongoing in this area, and we don't really know the magic number for those things. But what we do know is that in some athletes, their body is just broken down by the time that they get to the level that they were hoping to get to, and then that's really sad for them. And so there's a lot of research in looking back and trying to figure out what can we do to give recommendations to athletes and parents as well as coaches on amount of time they should be spending and how much of a particular sport they should be playing. Baseball has pitch counts, basketball's adopting things like practice times and recommended game schedules. And so it would be great to look at your particular sport and your youth athlete and see what that college or that particular sport is recommending so that we can hopefully prevent athletes from peaking too early and not being able to get to the high levels they are hoping to.